So you got your standing water. That, of course, brings mosquitoes and an awful lot more. Hurricane Irma is leaving Central Florida in its wake, thank you, with a number of potential health risks that are out there. So let's talk with Dr. Timothy Hendricks, Florida Hospital Central Care. Dr. Hendricks, always good to see you. Thank you, sir. Let's talk about some of those risks. Let's start with the mosquitoes, because obviously there's so much standing water, you can't clear it out from around your house. So they're going to breed, and what kind of risks are we going to get with that?
Well, right now, with being summertime, we're typically more alert to mosquitoes. The county health departments, I'm sure, are going to be watching for the type of viruses that mosquitoes carry. Of course, Zika is one of those, but we have not had any reports of Zika in Florida since last year. But also encephalitis types of viruses, in the West Nile, that type of thing. So I'm sure we'll be watching out very carefully for those, because that's going to be a heightened risk because of all the standing waters and the mosquitoes being able to propagate.
And a lot of people are getting out in that water. Some people because they're just wading through it. Some people are cleaning up around their house and they can't, they have to get out in that water. And that water is not just rainwater. There's an awful lot mixed into that, right?
Oh yeah, it's the sludge from humanity is in there. It's waste. It's going to be bacteria, and it's going to be oils and carcinogens and things like that. So it may look inviting, to go out there and play in it or whatever, but just stay away. I mean, the videos I've seen of people doing things in the water, they just need to stay away. And if you do have to go out into the floodwaters and do anything, to make sure if you have any open wounds that you wash that with soap and water. You decontaminate after exposure to that.
Gotcha. All right, the floodwaters can also stress everybody out. Yeah. Do you deal with that as well? Do you deal with people going, I just can't handle it, man?
Well, true. We do see people coming into Central Care and Urgent Care having those anxiety crises, panic attacks, but also a lot of physical ailments that we can attribute to that stress.
Yeah.
Migraine headaches, abdominal pain, irritable bowel, all types of things that can be just tied back to lack of sleep and just the stress that's going on around them. So we will see more people coming in, and you've got to kind of tease those out as you talk to people and figure out what's causing that.
Yeah, when you're running 24/7 for the most part, can't even find a place to put your head, you're going to get some people who are stressed out. I know we were talking to the commercial break. You guys just launched something. Is it called eCare? Is that what it is?
Well, yeah, exactly.
Okay.
So in the state of Florida, we have telehealth, where you can talk to a provider, a physician, a nurse practitioner on your cell phone. So you download the app, whether it's Android or iPhone. You can go to your app store, download something called eCare, and sign up. And this week for the state of Florida, we're offering this free to all residents, because one of the things we've seen after prior hurricanes is the lack of access to health care for many people. Hospitals are flooded, doctors' offices are down because of damage or lack of electricity. So this is a great way for people to access. I've been talking to people throughout the hurricane on the eCare app, giving advice, prescribing medications as needed, and getting them the help they need.
It's like having your cell phone number.
Yeah, exactly.
Exactly like having your cell phone number.
A lot of people have my cell phone number.
To me. Dr. Hendricks, always good to have you in here. Thank you, sir.
Thank you.
All right, let's check in with.
Give that out.
Doesn't give